Oklahoma, 5 minutes for questions, please.
I feel sorry for the panel. It's funny because it seems like when I go after a panel like that, they always get, upset because I'm badgering the witness or something. I understand everybody's opinions runs high on this. I get that. But I'll be real frank with everybody. The federal government should get out of the people's way, and we shouldn't be mandating anybody to do anything. That's not the role of the federal government. The federal government is to provide opportunities and resources for them to have access and affordable access. And that's what we're trying to do here, affordable access. Oklahoma, which is I represent, is one of the states that only has one insurer carrier in there. We're one of 5. We saw premiums raised by 76% last year. It's not because of the Blue Cross Blue Shield is trying to be greedy, it's because they're trying to stay in business. I understand that. The regulatory environment is such that they have to continue to change so they can afford to provide the health care. But because of the regulatory environment, underneath, ironically, affordable health care, which is anything but affordable, it is causing premiums to skyrocket, and then it causes less affordability, means less access to our constituents. And all this committee is trying to do is find a way to bring those premiums down and allow access to be created. So, Mr. Weisky, and I hope I pronounced that right.
You did.
Okay. My first question is to you. Could you help explain why the regulatory environment that we're finding ourselves in right now is causing the premiums to literally skyrocket?
Sure. I think it starts with the risk pool. You may have a large risk pool, but when you've got loaded dice, it's very difficult to get a representative, 1 through 6, a representative sample when the dice are loaded. In other
What do you
words,
mean by loaded dice?
What I mean is that the risk pool, the people who are purchasing coverage tend to need it, and they tend to, that the folks who don't need coverage, who are young and healthy, are outside of the market. And so when you're looking at the people that are buying coverage to the ACA, that they're tending to be sicker, and I think as Doug had indicated, that it looks a lot like our high-risk pool looked from a risk perspective. It's a little bit better, but it looks a lot like that from that perspective. That's the concern. I think you need to lower the premiums for younger folks to get them into the marketplace. I think a lot of the burdens, the SEP issue, I think is one. There's a number of others where the Obama administration has set such stringent rules that make no sense. Their 3 Rs program has been a disaster as far as figuring out how you pay for the reinsurance and adequately price for the risk. The timelines are ridiculous. You're pricing a policy in March for something that starts in January. It used to be a month and a half before. Insurers don't have the data. There's a whole host of, I could go on probably for hours and bore everybody here.
Well, so if I'm hearing you correctly, if we keep things the way they are right now, are we going to create an environment for more access, or is it going to drive more insurers out of the market?
I think there'll be a few states like Wisconsin that will hang on by our nails for a while, but I think you can see in a number of states where the Tennessee commissioner who testified yesterday in front of Senate Help indicated that her market was near collapse. I think that's what you're going to be looking at over time in a number of states in the current environment.
Well, what we've been hearing is that both people, my side of the aisle and the other side of the aisle, we're passionate about our constituents. What strikes me is that here we are actually holding hearings on trying to fix a problem. I just wonder how much input you guys got to have when this thing was jammed down your all's throat. At least now we're trying to open it up and allow you guys to comment on it. If it's really about our constituents, then why would the other side be so upset that we're actually having public hearings on trying to fix it and get it better? I don't understand that. So I appreciate that you guys are coming here, giving your perspective, the state's perspective, and we're getting input. And I appreciate the chairman who has taken the time to listen and actually put up with some of the shenanigans that's going on the other side. Your patience, as you can tell, I wouldn't put up with. I appreciate you doing that, Chairman. But at the end of the day, This is about getting it right and fixing it for our constituents. So thank you for your time. Thank you for coming in here and giving your expert opinion. And we look forward to working with you to bring down the premium so it can be affordable and it can create access for our constituents to have health care coverage if they so choose to, not mandated to. Thank you.